All right. Hi, welcome to Notable Perspectives. I'm your host, Aaron Neinstein. Today, we're sitting down with Dr. Patrick McGill, Executive Vice President and Chief Transformation Officer at Community Health Network. In this role, Dr. McGill is responsible for population health management, value-based care, envisioning data-enabled strategies, overseeing information technology and digital transformation, and leading communities' effort to use analytics to drive transformation. We definitely have a lot to talk about.
Exactly.
So, Patrick, thank you for joining me today.
Happy to be here.
So let's dive right in. Healthcare organizations are often thought of as slow-moving and risk-averse. From what I've gotten to know of you, I get the sense that you are not that way and that status quo is unacceptable for you. So what are the key leadership qualities that are required to bring that kind of perspective and mindset to a healthcare organization?
Yeah, that's a great question. So I often tell my CEO, or my CEO tells me, look, if you're not making people uncomfortable, you're not transforming anything. And so my job every day is to get up and think about how we're going to drive change. How are things going to be different? What are we going to do differently today that we didn't do yesterday? Whether that's technology, whether that's people, whether that's how we get paid, whether that's, how we take care of patients. And so I think one of those leadership qualities is you got to have courage. You'll often hear me talk about you've got to have courage to either take a risk, put yourself out there, put the organization out there. Courage is one of the biggest ones. The other one, you gotta have vision, right? And I often tell people that clarity is compassionate. So when you're trying to lead people, oftentimes they want to do the right thing. They want to come to work. They're engaged. Most people are in healthcare for the altruistic reasons. They want to make people better. They want to drive, health and wellness. And so being clear on expectations of where we want to go and what we want to do is often I think it's compassionate because it helps people in their day-to-day work. In a lot of the meetings that I lead, we do something at the beginning of the meeting called Connect a Purpose. And so with that Connect a Purpose, it's the opportunity for people to tell a story, maybe how they were impacted by the healthcare system, maybe a family member. Really, when you deal with a lot of technology, IT folks, analytics, when they're separated from the bedside, it's hard for them to stay connected to the mission and the vision. And so we always lead with this Connect a Purpose to say, how's the work that you're doing impacting people's lives? It's easy for us, right? We get to lay hands on people.
Yeah.
So we're connected to that. But for people that are not, they often lose that perspective.
Yeah, that's a great way to achieve that. So speaking of clarity, how does Community Health Network think about identifying and prioritizing your transformation initiatives? And how do you make that clear for your organization?
Yeah, we often start with, obviously talking to the business, the clinical or business leaders, and we go in and say, what problem are you trying to solve? And then we think about, how can technology do that? Sometimes problems have to be solved with people. How do we do things differently? So it's really tell me what problems you're trying to solve, and then let us be part of the solution, bringing solutions, again, whether it's technology or other aspects. So that's the first way. Certainly we have strategic initiatives, strategic, things. How can we reduce cost? How can we do more with fewer people that are hard to recruit and find? And so it's really, kind of taking the strategic objectives and initiatives, but really listening to the people that are doing the work every day to say, what problems are you having and how can we solve them?
Is there a specific initiative you can call out that, maybe over the last year or two that you're most proud of in the organization?
Yeah, we often think about the patient journey. And another thing you'll hear me talk about quite frequently is that we have to think horizontally. Healthcare specifically is often a lot of vertical thinking. You're in a service line or a product line, or you're in the hospital, or you're in a clinic. And so and I feel like my job as the transformation officer is to force people to think horizontally, because that's how people experience us. They come into the system to solve a problem or whatnot. And so I think one of the things I'm most proud of is really kind of changing how we measure that patient experience. And through some partnerships that we have, we can really start to get granular on how people, different segments, are experiencing the healthcare system. This is another aspect I always tell, because I think it really shows some of the innovative ways to think. Access. So everybody you talk to has challenges with access. And so one of the things we started to do was measuring access. So we were looking at your typical things, third next available appointment, or how long did it take from the time your appointment was scheduled to you actually had the appointment. What we weren't taking into account is, did that appointment meet your needs as a patient?
Yeah.
And so now our measure for access is through a survey where patients are asked, did the appointment you received meet your needs? Yes or no? If the answer is no, then it asks some additional questions so that we can learn and change. But it's really putting the patient at the center.
Yeah.
It's not about third next available. It's not about how long did it take. It's did that appointment meet your needs?
Yeah.
Because that's what we ultimately want to do.
I love that example because I think people often sort of mistakenly think that digital is about an app, right? Or about the
Right.
technology. But what you're bringing to life is that it's about using data to illuminate the patient, in our case, the patient, but the customer or the patient's experience, and then use that data to help make you better and iterate.
Right.
And I think people lose sight of that too often.
Right. And I think the other thing is to be able to improve that experience or to improve did we meet your needs? That's not just a technology solution. That there's tech solutions in there, but there's people solutions, there's workflow, there's how we do scheduling and how people are entered into the system. There's all of these other things that really drive to that North Star of did you get the appointment that you needed? Did it meet your needs?
Right. So then everyone's moving towards that common North Star goal.
Right.
Yeah.
And we didn't start out as a tech initiative or an IT or transformation. It was what problem we were trying to solve. We're trying to meet the needs of people, of patients.
The other piece in what you mentioned that I hear so often from people is that as you go on your transformation journey, that the metrics that you started with are not the metrics where you end.
Absolutely.
Because the first thing that happens is you illuminate yet another metric and then another one, and you find that they're evolving over time.
Yeah, absolutely. Absolutely. I think, and that's where if you start being patient-centered, kind of understanding what problems you're going to solve, there's going to be different tactics to solve that
stay
problem.
Problem focused.
You stay problem focused.
Yeah, absolutely.
I love what you set up on stage was be married to the problem, but be flexible on the solutions.
100%. So speaking of data, you made a great comment as we were talking earlier around ROI and helping your organization make a business case. And you said, if you can't find an ROI, you're not being creative enough. So tell me your philosophy around building a business case for digital, for transformation, and how you communicate that with your organization.
Yeah. So listen, we always have projects that we need to have an ROI. And I think that, we challenge each other. We challenge the teams to say, okay, there is an ROI. The second half of that statement is all ROI is not financial. And so there could be a human ROI, there could be a workflow ROI, there could be a patient experience ROI. How do you quantify those financially? Well, it's a little bit hard, it's a little bit abstract, but you can always go back and push and say, what is the ROI? And if we're not finding a financial ROI, I always challenge them to say, can you look deeper? Are you thinking about this problem the same? Are you thinking about it from all angles and aspects when it comes to looking for the financial ROI, but think differently too. So think differently for example, the access measure. So we meet the needs of the patient, they get the appointment they need. There is a financial ROI there, right? They have an appointment, they have services, but there's also this stickiness that becomes. So there's the lifetime value of a patient and when they become sticky to your system. And so I think that's where you have to really start to think differently about how you measure ROI.
It sounds like you're almost saying that it's not a spreadsheet exercise, that it's a storytelling exercise.
Right. And if you can articulate that story and tell that story, I think now this is me as a physician, right? I'm sure every CFO that's listening.
I was going to ask you how your CFO feels about PowerPoints over Excel.
Every CFO that's listening is like, this guy's full of, he doesn't know what he's talking about. But that's just the family doctor talking. But it's really about, how do you calculate that ROI and how do you think differently about the entire aspect and the entire journey?
Yeah. I think the title of this podcast is going to be the family doctor and the endocrinologist walk into a bar and
start talking about ROI.
Exactly. Yeah. I think we just titled the episode here. So shifting gears a little bit, your role is transformation for a health system. One of the things that's top of mind for people is how is this going to impact my workforce, right? So not just your physicians, but your physicians, your nurse, your clinical staff, your administrative staff. How do you think about transforming the workforce and preparing people for how those shifts are going to happen over the coming years?
It goes back to what we talked about earlier about really what problems are you trying to solve and how if that problem involves somebody working differently or doing different work, let's be clear about that as we're working through the process of designing interventions or designing technologies. And so, there's that common, we're all rallying around this problem of how we do it. Now, one of the things I do think, there's been a lot of talk recently in the last few months about generative AI and what's it going to do to workforce. But I think it's scary to a lot of people, but I think that really the conversations that we're having is it's let's embrace it, but let's think differently. And so it might be upskilling of our workers. It might be that they've done this job for years, but they're going to do a different job in the future. And think, I don't know this exact statistic, but it's that statistic that's out there about 90% of the jobs today didn't exist 15 years ago or whatever it is. It's that kind of thinking that we've got to, don't be afraid of it. Let's embrace it so that we can work differently. And, in healthcare, the EMR is the perfect example, right? We didn't have, 500 people IT teams before we had EMRs, but now we do. And so it's just about different work. We had different IT folks, or we had people in IT, but they were doing different things, right? They were deploying landline phones and fax machines, and those people have really converted to working in the EMR. And so I think it's preparing. We talk a lot about with our analytics team and some of our data architects and others that are afraid of cloud, right? We're an on-prem organization, but what about moving to the cloud? That's going to put me out of a job. It's like, no, we need cloud architects. We need cloud security. This is an opportunity to really think differently. Yeah. And it's the same for physicians. I always challenge physicians and say, when they say, I can't learn anything new, I always challenge them and say, how many of the medications that you prescribe today were in existence when you were in medical school or finished residency? Surgeons, how many of the procedures, most of the surgeons, probably not so much today, but many of the surgeons weren't trained on laparoscopic procedures, but they learned how to do it. So medicine and healthcare is constantly changing. And so we need to challenge ourselves to constantly change as well.
Yeah. Can you tell that to the public that their surgeons weren't trained on that?
Exactly.
Speaking of AI and you being very problem focused, what are some of the problems that you think about in your world that have been just intractable, that you think now as you're seeing the AI capabilities advance, where you think, wow, maybe this problem that I felt was intractable a year ago or 2 years ago, as you look into the crystal ball, what are you excited to be able to start working on over the next few years that wasn't possible before?
Yeah, I think really probably the biggest one, and if you think about AI in healthcare, a lot of it's been in that rev cycle space with billing and coding, and so some of those more administrative functions. What I'm really excited about is we've talked about for years and heard for years how much data is in the EMR, and it's all unstructured, right? It's all written in notes, and so really, how can we help clinicians be clinicians in terms of we're going to surface the information to you, and then you use your expertise and skills to make a decision versus trying to dig through the chart. So a lot of that's what I'm most excited about with generative AI is really that augmenting the clinicians, doctors, nurses, pharmacists, APPs, other providers. Really, how do we augment their work so that they can be focused on the patient again and not on the keyboard and not on some of the other things? That's one. I do think that healthcare has really lagged behind other industries in that segmentation and personalization. And I think that really this AI is going to allow us to do that personalization and segmentation in ways that we've never really been able to do it before in healthcare.
Right. The clipboard, right? Everyone gets the same clipboard.
Everybody gets the same clipboard. I always laugh and say, you know what? We have one segment in healthcare. It's called a patient. And I think we need to think differently because people want unique and personalized experiences. We get it in every other aspect of our life except in healthcare.
Yeah.
And so we've got to change that. And I do think that AI will accelerate that over the next few years.
Yeah. It is. I mean, it is weird, right? Like, why should we get more personalization from Amazon than from our doctor?
Exactly.
Yeah,
exactly.
I want to ask you to reflect. Oftentimes, you strike me as someone who's very thoughtful about past experiences. Any learnings come from failures and challenges. Anything that didn't go as you'd hope that you drew learnings from and has inspired you or your team to think differently going forward?
people ask me that question quite frequently. Maybe it's because I have so many failures. I don't know that's probably what it relates to. But I have one. I was asked to lead a program 6 or 8 years ago around changing how we deliver primary care. And really it's about workflow. If you think about it, what we were trying to do is really patient-centered medical home without some of the certifications, rules, and regulations and paperwork. At the end of the day, the program failed. And part of the reason it failed is we didn't go into it. We went into it with the wrong mindset. The biggest one is we didn't have aligned incentives for the physicians, asking them to change. We were asking them to do more value-based care and kind of population health work, but we were still paying them on a work RVU model. And so that makes it sound like it was a financial failure. The leadership lesson that I learned in that is you have to have aligned incentives. And I'm not talking about financial incentives. You have to have aligned incentives when these types of programs. So think about technology that's coming into to your last question about how are we asking people to work differently? We have to have aligned values and incentives to get people to work differently. And so that was the leadership lesson that I learned many years along my journey. The biggest takeaway was if you can create that alignment and vision and alignment in the strategy and incentives, you can have a lot more success.
Have you instantiated that in any way? If from learning that lesson, is that just something you kind of hold in your head, or you have a checklist, or like?
No, I don't have
you instantiated.
Yeah, I don't really have a checklist, but it is something that, as some projects are easy, right? Everybody's gung ho, but I always start to think about when maybe a project's going to be really complex, or it's maybe not going as well as I think it should be going. Like, okay, let's take a step back and think about, are we all aligned? Did we do the work? And to your comment earlier, what I have to tell myself is, like we talked about in the beginning, I'm here to drive change and transformation in the organization. We like to go fast, right? We need to go fast, but sometimes it's that kind of slowing down and being thoughtful and methodical.
Go slow to go fast.
Exactly. And I have to tell myself, personally tell myself that quite frequently.
Yeah, totally makes sense. So one question I like to ask everyone who's on the podcast, maybe because I'm a reading junkie. What are your favorite sources of information? What do you do to stay current? What would you recommend as like 2 or 3 great sources that you turn to read?
I read kind of all the periodical type things, your websites and your blogs, your Beckers and those types of things. That's where I get a lot of my healthcare information. I do a lot of reading outside of healthcare. And so a lot of history and a lot of leadership and a lot of those types of books that I love to read. And I, try and translate them into my current day-to-day work. But, I'm just an avid reader. So I'm constantly reading anything that comes across my desk.
Yeah. Well, you're talking to a former American Studies major here. So yeah. Find me the nonfiction shelf and let me at it.
Exactly.
Anything else we didn't cover that you wanted to share with the audience?
I don't think so. I mean, I do think that we're in exciting times. I know everybody probably says that, with every 3 to 5 years that we're in exciting times. I really do think. And I think that while there's a lot of challenges in healthcare, I think it's incumbent upon the people. We talk about disruptors and disruptive innovation and some of these types of things. I think if we're going to really, truly transform and change healthcare, it's going to have to be done from within. And at the end of the day, it's still people taking care of people. Whether we do that with the assistance of technology or other modalities, it's still people taking care of people. And I think we have to remember that in healthcare.
Yeah. I mean, you said it before, right? Like how can we use technology to let the doctor turn away from the screen and back to the patient?
Exactly. And how can we make the experience something that people, we're in an industry where 99% of people don't want to be there. So we run a 24/7 business. If you're in a health system, we're always open. Rarely can you turn people away. And 99% of people don't want to be there.
Yeah.
And so how do you build great experiences and some of these other things in that when that's your construct from a business proposition?
It's a tough one. Well, thank you so much for being with us, Patrick. So many great lessons in there for people. Really appreciate it.
Yeah, absolutely. I appreciate you having me on.